my soul. Hello, everyone. My name is Reverend Dan Diaz de Leon. I'm an ordained Assemblies of God minister. And for the last almost 6 years, I have also been a hospice chaplain. I wanted to share something that I have learned over the last few years that I think would be of great benefit if you're involved in ministry to homebound patients, dementia, Alzheimer's, hospice patients, that will help you, and that is the benefits of music therapy. I remember visiting with a dear sweet lady, a patient, and she was a Christian, and she was having trouble with memory loss, had Alzheimer's. And I found out that she loved the old hymns like Amazing Grace and several of the others. And so I would take my guitar and I would play for her whenever I would go to visit her. We would sing. Of course, I would pray with her, bring her communion and so forth. But it was the music that really made a huge difference. On one of those occasions, her daughter was visiting, and we sang, went through the whole visit together. And at the end, her daughter came up to me. She said to me, "Pastor, she has been having trouble remembering my own name, but when you started singing the hymns, she knew every word, every chorus, every verse of all the hymns that you sang." And she just couldn't believe how amazing that was. And of course, afterwards, she could remember her daughter's name and even my name, because there were times she wouldn't even remember mine. And so I saw how important it was to use music. So I use it quite often when I visit my hospice patients. That same story has repeated countless times with people who are having trouble. So I wanted to give you some information. A lot of this information can be found on a website called musicandmemory.org. And so I want to start by sharing some information by Dr. Oliver Sacks, who is a neurologist and a best-selling author of Musicophilia. He says, "The past, which is not recoverable in any other way, is embedded as if in amber in the music, and people can regain a sense of identity, even if it's for a short period of time." And so there's a number of research information out there, and you can find these all on that website, musicandmemory.org. Here's a study that was done on the impact of music and memory on resident level outcomes in California nursing homes. The use of antipsychotic drugs declined by 13%. Anti-anxiety meds declined by 17%. Days on medicine declined by 30%. And aggressive behaviors were reduced by 20%. That's pretty impressive figures. Here's a study done by the University of Utah Health Department. Music activates regions of the brain spared by Alzheimer's. In it, we see that familiar music may facilitate attention, reward, and motivation, which in turn makes it more possible to manage emotional distress in Alzheimer's. Another study by Stony Brook University on music and memory and improved swallowing in patients with advanced dementia, they found that personal music intervention improves swallowing in individuals with advanced dementia, making eating easier and potentially diminishing reliance on feeding tubes and PEG intervention. Here's one from the Kansas University Medical Center. The study was an individualized music-based intervention for acute neuropsychiatric symptoms in adults with cognitive impairment. They found that agitation, negative mood, and positive mood all benefited from the music-based intervention. Here's another study, music intervention to prevent delirium among older patients admitted to trauma intensive care unit and a trauma orthopedic unit. They found a statistically significant reduction in heart rate, systolic blood pressure versus no change for the control group. Here's one from Brown University. Individualized music program is associated with improved outcomes of U.S. nursing home residents with dementia. They found that discontinuation of antipsychotic meds decreased 23.5% to 24.4%. A New York City Health and Hospitals study on music and memory in dementia care, this is a 2017 study, found significant reduction in the transfer of patients to psychiatric ERs for behavioral and psychological symptoms of dementia, significant reduction in falls, and physical altercations. These are some amazing results. Here's one, the Alzheimer's Association. Repeated exposure to familiar music alters functional connectivity in Alzheimer's disease. In other words, listening to pleasurable music is known to engage the brain's reward system, so scientific reports. Again, you can find a lot of these studies at musicandmemory.org. Here's some benefits of personalized music. First of all, it helps recognize food, follow cues, and swallow. It can relieve anxiety by the eating experience, reduces feelings of confusion, has a soothing effect with positive memories. It stimulates movement, releases opioids in the brain, and it brings pleasure. Happy memories reduce pain, encourages movement, relieves pain from stiffness, helps people relax, improves cognition and communication, improves duration and intensity of concentration, relate to their caregiver, feel safe, follow cues, relaxes tense muscles, decreases anxiety, blood pressure, heart, and respiratory rate. Singing uses consonants and vowels, activating speech. It connects people to their identity, emotions, auditory, and visual perception. So you can see that there's quite a lot of benefits. You don't have to be a professional music therapist. It helps if you are, and we need more of them. But if you are involved with homebound ministry or hospital visits, you deal with any kind of Alzheimer's, dementia, or hospice patients, using music will help improve in so many different areas. Now, you might say, well, I don't play guitar, I don't play any instrument. If you do, great. If you don't, nowadays you can use your phone, pull up videos on YouTube, and there's all kinds of videos. I came across one. I typed in the words music for dementia patients, and I found playlists that were already created by different people, and they put them on YouTube. But it's best if you create a personalized playlist of the type and style of music, the genre that the patient prefers. And so what you want to do is learn how to create a personalized playlist. You need a computer to host your music library. Of course, nowadays you can use an iPad, you can use a phone, a smartphone. Again, you can use a portable music player, or again, you can use a phone device. Have a pair of lightweight, adjustable over-the-ear headphones. Now, I'll tell you why headphones are so important if you're going to put it on a device to share with someone, because having headphones will help them to drown out some of the background noise that some of the patients experience with Alzheimer's and dementia. They'll hear a lot of background noise, and so they have trouble distinguishing. When you put headphones, it blocks out all the background noise and helps them to focus just on the music. Make sure you find your loved one's favorite kind of music. You don't want to go in there playing rock and roll if they like old gospel hymns, or vice versa. So you want to find the style that they like, the kinds of songs that they like. Make a playlist. Start slow with a few songs at a time until you create a playlist of maybe 20 to 40 songs. And this last part says, be thoughtful when to use the music. You could use it pretty much any time, but if it's best to use it if you're going to have somebody come over to visit, for example, family members. Do the music therapy part of it 20-30 minutes before they come to visit to help them get in a better mood, maybe improve their memory, maybe before they're going to eat their dinner. Put some music on. Again, all of that helps with all the different things that we looked at. So there are a lot of benefits of music therapy, and I have been fortunate enough to have been using music, playing my guitar, singing songs, country western, gospel, and so forth, to help my patients be in a better mood and enjoy their day and retain some of their memory, even if it's for a short time. If I can improve their life for just a little while and be able to minister to them and pray with them and share with them the things of God's word or communion, all of those things are just a great benefit. Music is just a tool that we insert into the process of ministering to people. And I want to just encourage you to use music in when you minister to others We understand, if you're a Christian, you go to church, you understand the power of worship music, you understand the power of singing together, the hymns and so forth. It's the same thing when you're dealing with patients who are having trouble with their memory. When you start using music, it just recalls pleasant memories and it puts them in a better mood. And it's such a wonderful way to get them to experience and even relive some of their happy memories and start sharing some of those memories with you. There's couple of patients that I see now, husband and wife, and I start sharing some songs with them, and the wife just lights up. She goes, we used to go out and we used to love to sing and to dance, and they just brought back so many wonderful memories, and she just lights up with a big smile on her face every time we sing some songs together. And so they look forward to it. I hope that this little short video will encourage you and help you in using music therapy in your ministry to Alzheimer's, hospice, and dementia patients. Hey, thanks for listening. Share if you'd like with others that might could benefit from this. Thank you very much.